us close the care gap so that we have equal access to cancer care. People living in developing countries do not have good quality cancer care most times because of finances and also because of weak healthcare systems. And this is really unfair because we get cancer, our cancer patients usually come at an early age. And so their life is cut short. They are not able to take care of their families. They are not able to live a good life. They go through so much during their illness. We don't have good systems in place that focus on prevention, on early diagnosis, on the best quality care of treatment, and also not just managing the disease, but also even palliative care and rehabilitation and survivorship. Yes, we are trying our best, but we have many gaps. We would like our patients to live as long as possible once they've had a diagnosis of cancer. Of course, we would like to focus mostly on cancer prevention. But once the patient has the diagnosis, then what next? They should be able to access the best care. It doesn't matter where they live. It doesn't matter what age they are. It doesn't matter whether they are rich or poor or what color they are. They should be able to access good quality, high standards of care. We don't want guidelines that talk about guidelines for resource limited countries. Those are not the highest standards of guidelines. Why are we having different guidelines from other places of the world? So we need to focus on closing these gaps globally together. Join our hands and focus on closing all these gaps that exist in cancer care. We must try to focus on quality of life, on survival, on reducing cancer cases, and also even gaps in research exists. We need to close these gaps on research. We need to have, local evidence so that it can inform our practice. So these gaps are very important for us to address and close. And it's our duty as human beings to actually do this. We talk about universal health care, we talk about human rights. But when you look at cancer care, these are not things that we are addressing very well. We need to address cancer from the human rights point of view, that people need to live and survive and live a good life. So please, let's close this gap. What gap do you want to close? I want to close all these gaps if possible. Let's close these gaps together.